Hey, I'm Dr. Renicky with CellGen Regenerative Medicine. So I want to take a moment to talk about some of just the basic principles and concepts of what is meant by regenerative medicine. So to begin with, the focus and the purpose of regenerative medicine is just like the name implies, is designed to get parts of your body to regenerate. Now, we're not there yet. I'm sure it's not terribly far down the road, but we're not there yet of being able to help you to grow a whole new arm if your arm gets horribly torn off or something like that. But what we can do at this moment is we can use regenerative medicine to help you to rebuild and regenerate cartilage in your joints. That's something that we have ironed out right now. I've seen some very exciting things where they're like growing body parts on the backs of other animals and that they're going to be able to plant those. We're not there yet. That sort of thing will come. But for right now, what we do have is that you can get regrowth and regeneration of cartilage in a degenerated or arthritic joint. So there's two main things that we're using in regenerative medicine for that type of situation. We can either use what's called platelet-rich plasma, or we can use stem cells. So what platelet-rich plasma means is that we just draw blood from your body, we spin it around really fast in a centrifuge, and it separates out into 3 layers. The bottom layer is going to have all the red and white blood cells. They're the biggest and the heaviest, so they all go to the bottom. The top layer is just going to be plain, clear plasma. So in other words, it's just the liquid of blood with nothing else in it, no blood cells of any type. But the middle layer here is going to be full of all your platelets. And platelets are what allow your body to clot whenever you cut yourself. And if you cut your hand, then there, of course, is going to have to be repair. There's going to have to be regeneration of the skin cells to close that back up so that dirt and germs and things like that don't get in there. And so you're going to need to get stem cells to that area to turn into new skin cells to be able to heal that cut. And platelets are what call stem cells to that area. They're one of 2 things that will call stem cells to a particular area. So you got platelets will do it and inflammation will do it. Both of those are the body's distress signals that say, help, 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 come here, stem cells. So we can pull the platelet-rich part of your blood out and inject that into a particular area to draw stem cells to that. So if you've got a bit of a tear in your rotator cuff, injections of PRP, platelet-rich plasma in that area, very often can bring your body's own natural stem cells to that area to be able to help you to heal up from that. If you've got a joint that has been injured, not just degenerated over a length of time, but something where you really significantly injured a joint and it's relatively acute, platelet-rich plasma can be a really powerful tool for that. It does work better in younger people than older people because, again, it's not the most effective strategy for a degenerative arthritic joint, but for something where we've got an issue like a rotator cuff tear that very typically doesn't heal well on its own because we keep trying to use our arm and we're trying to do things with it that keep aggravating and irritating it, then using platelet-rich plasma to bring those stem cells to that area can help to get that to heal better. But if you're talking about something like a degenerative arthritic joint where the cartilage is worn away and maybe not quite yet, but you're getting close to bone on bone, then stem cell therapy would be the right tool for that. So you can inject stem cells directly into that degenerated arthritic joint, whether it be a knee or a hip or elbow or the sacroiliac joint, and then you're able to now get the cartilage in there to start to regenerate. And you can get lubrication now, you can get cushioning, and the joint will stop hurting so badly, and it'll make it to where you get a lot more function back. So regenerative medicine has those 2 main approaches that it's using at the moment. I'm sure it'll evolve and I'm sure there'll become more, but those are the 2 main approaches for right now. And those are both services that we're offering in my regenerative medicine practice of CellGen Regenerative Medicine.